Gum disease is basically when you look in your mouth, you'll see teeth. Then the teeth is the white part. Okay. Then the other part that looks like flesh, which is red,
yes,
or pink, or dark,
yes,
depending with your ethnicity. So that thing that supports the tooth is what we call the gum. Okay. So it's not the tongue, it is not your cheek, but where the teeth ends and that starts.
Okay.
That's where the gum starts. And so gum disease is basically a disease of that gum that holds the tooth.
Okay.
And the telltale signs are there. Probably today in the morning when you brushed, you saw a bit of blood on the sink.
Ah, yes.
Okay.
Yeah.
Or you probably say when you woke up you spit a little bit of blood. Okay. As long as it's not coming away, it's not coming from your tummy or anywhere else. So most likely you're having gum disease.
Okay.
And gum disease, the initial sign is an inflammation or a swelling of your gum.
Okay.
Okay. And that swelling will manifest as bleeding, because a swelling means the blood vessels are there. Okay. So probably when you brush, if there's inflammation, which is a swelling, then you'll get a bit of blood. Okay. Probably you're having a bad breath. Okay, that is also a manifestation of gum disease. Okay. Or probably you're having spaces in your teeth that were not there. Okay. So that is also another manifestation. Your teeth, no one has hit you. Okay. Or you haven't fallen. And you're feeling your teeth are loose. That is also another sign of gum disease. Or your teeth is becoming taller and your height is not changing.
You will not go there. So these are the signs.
These are the signs. Okay, unashanga meno imerefuka, but you're the same height. So you're wondering what's happening. Okay. So those are some of the signs of gum disease. Okay. Or probably you're feeling there's a swelling on the gum and you're having pain. Or even sometimes you'll get some uzaha or what we'd call pus on your teeth. And you'd wonder what is happening. Okay. All those are signs. Or even a tooth that was there for a time, then over time it's become loose, then all of a sudden you become your own dentist. Unangoa. Instead of coming to Dr. Njano and leto asema meno ilingoka peke yake. It's because that's an advanced form of gum disease. Okay. And the most common causes of gum disease is plaque.
Okay.
Then the other factors now that contribute to it. As we've said, plaque is just an accumulation of the food particles on the surface of your teeth, then with the bacteria, then with the moisture in your mouth.
Okay.
That attaches on the surface of your tooth. If you do not brush correctly, as we said last time, brush before you sleep and brush in the morning and floss your teeth and see your dentist regularly. Then the plaque will accumulate on the surface of the teeth. Also, apart from causing dental decay, it will cause an irritation of the soft tissue, which is the gum. Okay. Once it causes an irritation of that, then the body's way of responding to disease is inflammation. Okay. Then now you'll find your gums are red. No one's beaten you, or you're not even light skin. Atumepigwa imechange color. So you get your gums are redder than they used to be. So that's one of the signs of gum disease.
Okay.
With time now, the plaque that was there hardens. Okay. Once it hardens, it forms what we call tartar. Or in other terms, what we call calculus. Na sile calculus ya maths. Ila X, Y, Z. Teacher wa maths. Terry would say teacher wa maths. Hapa ni wapi? Tuko studio. So so your calculus, calculus or tartar. It's hardened stuff. And what calculus does, it irritates the gum. Okay. In normal life scenario, there are people who respond differently. To situations. Kuna wenye they are non-confrontational. They'll start moving away from you because they don't want a fight. So because they've put up a fight before, which is inflammation, and now the fight imezidi. There's some other factor. Okay. The enemy has come. Wameongeza battalion. Alianza na plaque, sasa ameongeza tata. softy, plaque is soft. Tartar is hard. Okay, so the gum says, hey, this battle,
It's too much.
it's too much. So it starts moving down.
Yeah.
Okay, so once it starts moving away from the tooth, what makes it be there and not shake is because of the attachment. Okay, the supporting tissue, which
Yes.
is the gum and the bone. So once the tartar irritates and the gum starts moving away,
Yeah.
that disease process starts as what we call gingivitis, which is gum disease, primarily the gum tissue.
Okay.
But now the other supporting structures, the bone and now the ligaments that attach the tooth
Yeah.
to the bone. So then it irritates there. It gets to the point now it starts eating the bone.
But it's gradual.
It's gradual. It's not something that is
overnight. That I'll wake up
No,
and then-
no.
Yeah.
You'll see signs, pole. And the first sign is probably that I've said. You see, spit a bit of blood when
Yeah.
you brush. Okay, you're getting a bit of sensitivity, which was not there.
Yeah.
Which means the gum is moving away from your tooth. Okay, your
Yeah.
gum is a bit red. So those are the telltale signs.
Okay.
And as we say in Kiswahili, samaki mkunje, angali
mbichi.
mbichi. I
Yeah.
see you are very keen in your
My Kiswahili
Kiswahili.
teacher is proud of me.
Yeah. Hapo amefurahia.
But for us, mostly we wait for it to
Exactly.
even go on and on and on till
Exactly.
we're in so much pain
Exactly.
that we can't take it
That
anymore.
we can't take it.
Yeah.
And then when you come at that point, it means probably you're even having an infection on the gum tissue. Okay? And that means probably the gum disease has progressed,
Yeah.
formed inflammation, and formed an abscess.
Yeah.
Okay? And that's the time most people will come to the dentist. But as I'm explaining, it's a gradual process.
Okay.
And you can stop it at a particular point so that the progression does not continue. Okay?
Yeah.
And apart from now the plaque, there are other factors that contribute to gum disease.
gum diseases,
Yes. You might be taking some medications that are probably causing a dry mouth. Okay. So then you're not able to have proper cleansing ability. People who have systemic diseases like diabetes, okay, are also exposed, because they are what we call there are things that cause inflammation within the gums.
Yeah.
They are quite increased in them. Okay, there are also other diseases that decrease your immunity, so you're not able to fight disease properly.
Yeah.
Okay, for people who also smoke. Okay.
Ooh, okay.
Yes.
Yeah.
There are studies that have been done that associate gum disease to smoking. Then there are also hormonal changes. Probably
true.
for women who, when they are pregnant,
Yeah.
there's a lot happening in their bodies.
Which again, I've never understood the connection. When a pregnant woman and the tooth is aching, I really don't understand the connection.
The connection is usually,
Yeah.
you see now when you're pregnant, there's a lot of things happening.
Okay.
Like probably in the first trimester, you're having a bad nausea. You don't even want to put a toothbrush in your mouth.
True.
Okay? So, and that will lead to also plaque accumulation. There's also hormonal changes taking place within
In
the
a
body.
Yeah.
And the teeth are not in isolation from the rest of the body. Whatever inflammation is happening there also spreads to the gum.
Okay.
So then there is an increased chance of them developing gum disease.
Yeah.
And even we say it's important for pregnant women to have their dental checkup done.
Yeah.
Because there are studies that have been done. For people who have advanced gum diseases, women who are pregnant, that's what we call periodontitis, have chances of having preterm labor.
Oh, okay.
Yes, there are studies that have been done that associate
Yeah,
that.
yeah.
So, and then there have been myths that when you're pregnant, you can't see a dentist.
There's that as well.
There's
yeah.
that as well.
Which really isn't the truth.
Isn't the truth.
Yeah.
Because at the end of the day, we'll advise you. There are things we'll tell you, let's first cross the first trimester into the second trimester.
Yeah.
Then we sort it out. Okay?
Yeah.
And then would rather actually have that issue addressed. If it's not a very invasive procedure, then what needs to be done can be done. If it's invasive, then it can be probably postponed till the child is born.
Yeah.
Okay? But you'd rather see the dentist. They'll sort you instead of taking lots of medicines,
Yeah.
which in terms of probably safety issues on the way they classify safety of medicines in pregnancy.
Yes.
And you see, toothache can be bad. So then you'll be forced to take meds
Yeah.
that ideally you wouldn't be allowed
you
to take
shouldn't
when,
be taking in that
when
condition.
you're pregnant.
Yeah.
Yes.
Man, we have already begun, and I tell you, I'm seeing already questions in Engia. So please send them questions in. 0727907907 is the number. Today we are talking about gum diseases. Maybe you could be there, and some of the symptoms and signs that Dr. Njani has talked about. Probably you have gone through one or two, or and he has said it's very gradual. So maybe you have noticed some of the signs, maybe you have them, and you'd want for us to answer your question. Please do that as he's still with us in studio. 0727907907. In fact, you can even call in. We'll be picking your calls shortly. Kuna swali kwa hapa. Someone says, good morning, doc. Are gum diseases hereditary? This is Kevo from Isili.
There's usually some bit of genetic component, okay, and there's some trace, okay. You'd find that if there's some form, there's some studies that have shown there's some bit of genetic component, but now there are other factors that now accelerate the process. Okay, so if there is some component sour, but then you also have to take care of your hygiene.
Okay.
Yes, it might have affected someone else, but their problem might have been caused by something else. So you might get it because of something else.
Okay.
Yes.
All right.
Yes.
Another question. This is Dennis Kiria Nasema. Sugary things like biscuits and sweets. May this cause a problem? We can also talk about food as well. Can it also lead to gum diseases?
Food is actually one of the factors that cause gum disease.
Okay.
In terms of their sugar content. We call it carcinogenic diet. Diet that will cause caries will also lead to accumulation of plaque. If you're taking too much sugar, you're not observing your oral hygiene properly, that is fodder. That is food for the bacteria. Okay, and that is what forms part of the plaque. And as I've told you, plaque is the one that causes the gum, the inflammation of the gum. So it's actually the one of the ingredients in the whole meal. Okay. Yes.
All right. Watuma maswali yako as we continue on and on. Someone is asking, what is floss? You had mentioned earlier on, brush regularly, floss if you can.
Yes.
And anauliza, what is floss?
A floss is actually a device, just like a toothbrush, that is able to clean in between the teeth. Because you see, a brush can't get into the areas between the teeth.
Yeah.
So the floss is, I'd say, almost like a string. So it can be a string. Others are in the form of a bow that you're able to clean in between the teeth. So it's just designed to go into the closest contact between teeth.
Yeah.
Yes. It's able to go through between the teeth, but not hurt you.
Yeah.
Yes.
And I'm sure Mayona, probably it's the name,
Yes,
but
yes,
Mayona, in some places where there are a lot of people, you see some people just flossing.
Yes.
Probably Mayona, that one that looks like a bow.
A bow, yes.
It's very common.
Na kuna watu wanatumianga wanairudisha kwa bag.
It shouldn't be.
No, once you use it, then
That's
you should discard it.
So we should have as many as
kuna watu
possible.
wengine wanaiweka ni kama kichana. You use it, then you put it back in the. Actually, they are sold a number of them, but kuna watu wanatumia then anaiweka. So I wonder if it's the string one. Will you use it and put it in the bag? No.
Yeah.
But here bow, people have a way that anaiweka hapo, then hata wengine labda they'll take it home, anayosha kama vyombo, then ananini tena.
Anaitumia tena another time.
Tena.
So once you're done with it,
you should discard. Ni kama toothpick.
Yeah.
If you use a toothpick, you discard it.
True.
Ideally, we do not encourage the use of a toothpick, but in most cases when people use it, you discard it. So the same thing should happen.
And even as you're talking about toothpick, because sometimes I see some people who they use the toothpick, but it will end up having some bit of blood stain.
Exactly. So those are some of the things, because you find probably the area they are trying to dig through is a place where there's probably a cavity, and they're trying to chuck food from there.
Yeah.
And what happens is if food has accumulated at that area, it's actually between two teeth.
Okay.
So you can't be able to remove properly. So you see there's a bit also of inflammation happening there. So ukitoka na toothpick, toothpick also will poke.
Yeah.
Because it's sharp. So if there's inflammation, it will poke. Or even if you use it badly, it is a problem to your gum because you're traumatizing it.
Yeah.
Yes.
Let's also talk about the use of our toothbrush and
Yes.
sometimes how they are shaped.
Yes.
I don't know. So, some of us unatumia toothbrush 2 years, 3 years. You
Yes.
have never changed it.
Yes, yes.
And sometimes some of us who use, they're the ones that are really hard.
Yes.
So when you're using it to brush, it's really causing the bleeding in your
Yes,
gums
yes,
as
yes.
well. Let's talk about that. Which is the good a good toothbrush for us to use, and how often should we dispose it?
First of all, do not
Yeah.
use a toothbrush as a shoe brush. It is a shoe brush can last a year, 6 months, or even several months. But a toothbrush is meant at least 3 months. So if ujabadilisha toothbrush, tunaenda quarter ya mwisho ya mwaka,
Yeah.
this is your call
Yeah.
to go change your toothbrush. Okay?
Okay.
Yes, yes. So we advise use your toothbrush for 3 months. Okay, for different conditions. For patients who have gum disease that is advanced, we usually recommend a soft toothbrush
Okay.
so that doesn't hurt their gums. But for normal use,
Yeah.
we recommend what we call a medium bristle. Okay? Then there are people who probably are smokers, so their teeth have stains that
Yeah,
develop.
yeah.
So those ones can use a bit of a hard toothbrush. But you see that the problem is a toothbrush is hard,
Yeah.
and your tooth is hard. Okay, so if you brush, you do not need to brush too hard. You just need to brush gentle and take longer time.
Yeah.
But some people want to brush harder and take
Faster,
faster and take a shorter time.
Yeah.
Ideally, if you remember physics, when two hard surfaces come into contact with each other,
Yeah.
friction will happen.
Yeah.
And when friction happen, there is one thing that will wear out. You can replace your toothbrush at 50 bob. Even 100 bob.
Tuache hiyo mchezo.
100 bob ni chapo maybe 3 na mandondo, si ndio?
So please.
Kwa kibanda, si ndio?
Yeah, yeah.
So please, unaweza hata kibanda siku moja, take that day as your fasting day for lunchtime. Ununue toothbrush, hiyo so ingine unaweza toa sadaka kanisa, ama utume kwa Truth FM to support mission.
Be a pillar.
Be a pillar.
I tell
Be
you.
a pillar. Be a pillar. So ideally, get a medium bristle. Do not brush too hard.
Okay.
We say brush gently.
Gently.
Pole pole, take your time, at least 2 minutes. If you'll shower, especially for Terry, for 15 minutes or 10 minutes, 2 minutes ya kubrush meno is
Yeah.
not too long. Brush your teeth, brush all surfaces. If you have a floss. Okay, if you've probably been seen by a dentist and you need to use a mouthwash, you gargle a mouthwash and you're good. Also, when you get a flu, then it means there's also been a buildup of bacteria in your oral environment or in
Yeah.
your mouth.
Yeah.
Then that's
Change.
your cue to change a toothbrush.
Okay.
Yes.
Alright.
Yes. So ideally ukienda shopping,
Yeah.
ile ya mwaka unaweza buy 4
Za kuchange
za
every...
kuchange, na una mark unasema first quarter, second quarter, third
Umechange
quarter,
brush.
fourth quarter.
Some of us imekaa mpaka...
Yako imekaa hivi hata imefanya social distance. The Bristols imefanya social distance.
Yeah.
Imeenda huku na huko.
Yeah. Man, let's try and change that. But also, before we can also just get back to the questions, and you can send your questions, by the way, as Dr. Njana is still here with us, 0727 907 907. How long can one stay with a tooth that has the gum disease? How long? Because sometimes we prolong some things. I'll go, nitaenda too.
Okay.
First you're brushing and you've noticed, there's some blood coming out. Then you start noticing, wait, imeswell. My gum, I've sijalalo siku mzima. Then it's gradual, yes, but I'm still, ignoring. How long can I stay with such a tooth?
You actually shouldn't stay with it.
Okay.
Because that depends with the other factors. Maybe you have other systemic issues.
Okay.
Which will probably aggravate the issues faster. There are people whose progression might be slow. Because they're probably healthy, only that they have a bit of gum disease.
Okay.
So it might takes a slower time. But probably if you have something like diabetes, then it means the progression is faster. Because there's a lot happening. So ideally, if the first sign, you've brushed your teeth, you've seen a bit of blood on your brush, you've seen a bit of blood on the sink, that is your cue to come to the dentist. And the treatment we'll probably do at that particular point is what we call full mouth scaling and polishing. Okay. You come, you have a proper cleaning done by a professional. Then they'll be able to remove the accumulated plaque and what we call calculus. Then they'll also advise you on proper hygiene procedures. And that's why you always advise at least see a dentist every 6 months, because most changes in the mouth will
Yeah.
take place within 6 months.
Okay.
Yeah, even a cavity that was small, within 6 months,
Yeah.
there's progression.
Yes.
The same thing with gum disease. It will start slowly. Others might take longer, but others might take faster. So you see, you do not have control of what will happen.
Yes.
But you have control of what you can do at the initial stages.
Yeah.
Yes.
So depending on the stage, there's also different procedures
Treatment.
to
Yes,
go
the
through.
treatment procedure. So initially, if it's just accumulated on the gum, then you'll just come have what you call full mouth scaling and polishing. In some areas, if it's gone lower and it's affecting the root more, then they will need to clean the root, what you
Okay.
call root planing. So you'll come, then another procedure will be done.
Yeah.
The other patients whose gum has gone down, but the tooth is still strong. Now there are advanced techniques
Yeah.
where we can put something else on the surface of the tooth, then lift your gum and cover that tooth.
Oh, wow.
Then we do maintenance just to make sure you observing your good oral hygiene.
Yeah.
Yes.
All right. So we
Yes.
need to really come early when we start seeing the signs.
Yes.
Okay.
Yes. It is easier. It is less costly for you. And it's also, the disease process is not bad.
Yeah.
And you see, it's easier when you come to the dentist way early, because when you're not in pain,
Yeah.
the conversation is good. But when you're in pain,
We.
there is a lot of things happening.
Yeah.
Yes, yes.
Which most of us sijalala usiku mzima,
Ndio hiyo,
meno
ndio hiyo.
imefura,
Ndio hiyo,
you know all
ndio hiyo.
those. Hiyo ndio wa Kenya. A
Yeah.
question coming in, someone says, "Hi Dr. Njane, I have an inflamed gum just below my premolar and canine lower jaw. My lower jaw teeth are congested, yes. I use a medium Bristol toothbrush and change it monthly, but it has never bled, not painful. In fact, I notice it when I look at the mirror. What could that be?"
So there are various things that could be happening. So first, is the swelling hard or soft? If it's hard, it might just be maybe something else that is happening. But if it is soft,
Yeah.
there are various things that could be happening. Probably there's what we call gingivitis, that's inflammation of the gum. Probably there's what we call an abscess that is starting to form there.
Yeah.
And probably they've tried to manage it and it's not going out. So the best would be visit a dentist. Then they'll be able to assess and see the possible causes. Is it something that is hard? Is it something that is soft?
She's actually saying the swelling is hard.
The swelling is hard.
Yeah.
Exactly. So most likely it's not related to a gum disease.
Okay.
It might be something, you see where the tooth is, there's bone. So there might be a small growth of the bone that is happening. Or even it is just normal, but she's thinking it is a disease
a
process.
gum disease, yeah.
Yes, yes. And you see most of the time, where the tongue is on the inside surface of the teeth, there's what we call, this jaw is called the mandible. Okay? There are small inflammations that happen on the mandible of the bone that we call tori. Maybe she's had it before, but now that we're having this conversation, she's noticing it now.
Yeah.
So there are others that are normal, and if they don't affect speech or feeding, you let them be. But in some cases, if they affect maybe feeding or they have issues with them,
Yeah.
they can proper treatment can be done. The bone can be shaved a bit there,
Okay.
so that it is smooth.
Oof,
Yes,
okay.
yes,
Sawa
yes,
sawa.
yes, yes.
I see questions coming in. Someone says, "I know you're majoring on gum diseases. Could it be the cause of sensitivity? I recently struggled with tooth sensitivity. Got attended to by a dentist. He did the refilling. Burning question is, what is the root cause of tooth sensitivity when one daily brushes his or her tooth?" And this we have covered.
This we've
but
covered,
we
but
need to go
also
back.
gum disease is also a cause of
Yeah,
sensitivity.
yeah.
And Terry would tell you from the lessons we've had today, if your gum moves away from the tooth, it will expose a surface of the tooth
Yeah.
that is not supposed to be exposed. Like when it is cold and you're not wearing a sweater. Ideally, you'll feel cold on your hands. So the same, the gum is supposed to reach a certain level. But in case of gum disease and it started to move away,
Yeah.
then there's a part that ideally should be covered and it's not covered.
Yeah.
So then you'll start experiencing sensitivity. Yes,
yeah.
yes. So apart from the other myriad causes, gum disease is also a cause of tooth sensitivity.
All right.
Because if your tooth becomes longer than it was,
Yeah.
then it means there's a part that is now exposed that wasn't exposed.
Yeah.
Yes.
Especially hizo meno za huko nyuma kabisa. Kuna moja mrefu than the rest.
Yes,
And
yes.
you explained that
Yes,
last
yes,
time
yes,
you were
yes,
here.
yes, yes.
All right, let's receive some questions. Dombre, good morning.
Morning.
Morning, how are you?
I'm fine, thank you.
What's your name, my dear? We na ameenda hivyo. Yeah, so if you can call back, the better. We'd love to hear from you. Someone says, hi doc, I have a huge cavity and I have been using painkillers now. This week while brushing my teeth, I have noticed blood specks and I am feeling acha tuone hiyo message. Haijamalizika but amesema akona huge cavity.
Okay. A huge cavity is like a crater. Unajua?
Good analogy.
So a crater, things will go in there. Okay, and the way he said. So if it's a huge crater, then that acts as also a deposit. Ni kama ka bank chakula. Inaenda tu inaingia. Ya leo ina accumulate.
Okay.
Ya kesho ina accumulate hapo. Okay? So you see, apart from accumulating on the tooth, hapo next to the tooth there is gum.
Okay.
So you're not able to clean. So the gum there will also be irritated. Okay, and it will respond by becoming red.
Yeah.
And that's where you'll get the bleeding. And now apart from the bleeding, if the food keeps staying there, it will wear out the tooth surfaces, as we said. It will wear out the enamel, the sweater, wear out the shirt, the dentine, then get to the nerves, which is your skin. Okay, and the nerves is where now transmit pain. So they'll start experiencing pain, and probably now they've had some sensitivity, which they've had over time, and now the gum, which is where the food also inalalia, will suffer. So apart from your tooth, your gum will also suffer. Yes.
Ooh, all right. Aya, send in your questions. Unaweza piga simu pia 0727-907-907 is the number. Dombre, good morning.
Morning to you. How are you?
I'm good. How are you?
Fine, thank you. Majina ni Mucheke Henry.
Yes, Mucheke.
Niko na swali mbili. Ya kwanza, nilienda kwa dentist kungolewa meno. Lakini daktari aka-advise ni refill. Nikarifiliwa.
Yeah.
Alafu nikaambiwa nirudi after 3 weeks. Swali ni kwamba why 3 weeks? Alafu nikibrush meno yangu nikinini inatoa damu kiasi nikibrush. Kudibia inaweza kuwa na shida.
All right, sawa sawa.
Alala question ya mwisho.
Okay, I
have a brother-in-law. Alingolewa meno just some weeks ago. Alafu wakati alingolewa kwenda ikaanza kufura. Went back to the dentist. Akawa referred to another local hospital. Wakamrefer to Togoria Hospital. Within a week he died. What could be the problem?
All right, sawa sawa. Acha tupatie Dr. Njane opportunity ajibu. All right. Those are like 3 questions.
Those were 3 questions. Yes. Let's start with the less scary one.
Please.
Yes, so that we taper it pole pole. So he says he went to the dentist, had a filling done for a tooth that he wanted extracted, then he was told to come after 3 weeks. So there are 2 possible scenarios. Probably they did a filling and then they want to review him and see how he's doing after the 3 weeks. The other thing is probably a root canal was started.
Okay.
And in some instances, you have to come for multiple visits for a root canal.
Please explain a root canal.
A root canal, in layman terms, ni kuua nerves. Okay? So sasa when the decay, imefika mpaka kwa nerves. Okay? So you have to remove the infected nerve tissue.
Yes.
You disinfect that area properly. Then you'll now come, fill that area that you disinfected so that you have a seal. Huko kwa root bacteria haiwezi ingia na huko juu pia bacteria haiwezi ingia. So you seal the root canal. So the canal is where the nerves and the blood vessels zinapita. Yes. So probably he was having a root canal done. So probably he was told to come after 3 weeks for the other procedure to happen. So alienda siku ya kwanza, they removed the decay so that the tooth is clean from the bacteria that caused that problem. They go to the nerves, removed the infected nerve tissue, disinfected properly, put some medicine inside the canal. Then sometimes you do a temporary filling, to cover you the time that you'll be away. So now when you go for the second visit, they'll remove the temporary filling, clean and disinfect the area that they were doing the treatment, fill the canal area, then do a filling now on top. Okay.
All right.
So probably he went in for the first procedure, and after 2 weeks he needs
He was
to go
told to come back.
exactly. So that explains the 3 weeks. And it can be as little as 1 week, 2 weeks, 3 weeks. So the 3 weeks could be because of the diary of the dentist. So akaona in 2 weeks atakuwa ameshikana ama hata kuwa akuja after 3 weeks. Okay? Or probably Mosheke will be available after 3 weeks. Here we are dealing with scenarios.
Because it's also very why after 3 weeks?
Why after 3 weeks? So the other bit about his bleeding gums could be a sign of gum disease. If he's not had trauma, most likely there's gum disease that's starting, and he should have that addressed. The other third issue about the brother who had a tooth extracted, then went to the dentist, then was referred. Most likely he got an infection. Okay? And that infection might have led to what we call an inflammation of the jaw, a very severe form of disease called Ludwig's angina. Okay? Nimekupoteza. Sasa wacha nikutoe huko chini nikulete hapa. Kulete kwa ofisi. Ideally, where the tooth is, there is the jaw. Sindio? Then within the jaw, there are what we call spaces. Okay? Huku kwa cheek, huku kwa chini ya cheek, those are potential spaces. So what happens? A tooth decay happens. Okay? Then there is infection. Then there are other instances where probably where he had his extraction done, they were not very clean, or what we call it was not it was septic. As in the infection developed. So if an infection develops, then you'll get what we call an abscess. An abscess ni usaha in Kiswahili. So what it does, it starts to spread to the neck. You see, your nose and your mouth have a connection at the back of the throat. Okay? There's what we call the larynx. Okay? Hapo nyuma mali air inaanzia. So what happens, the pus spreads. And you get inflammation of where you're supposed to start to breathe. Okay? Once that starts, then you're not able to breathe properly. Okay? In some instances, the pus will almost spread to the chest. If it's not addressed early. So you see, if you're not able to breathe, then air is cut off.
For sure.
And if air is cut off, that's it. Okay? So those are the possible scenarios. So do not ignore a swelling that is resulting from tooth disease, because the repercussions can be as severe as that.
And you know, we don't even think about it.
We do not think tooth aje kupeleke nini. So probably that was what happened. He got that infection, which I've told you is called Ludwig's. Then it spread. He got an inflammation of where the breathing is supposed to start. Then eventually by the time probably he got to the hospital, it was too bad. Yes. It's sad, but that's really those sad. Are some of the possible scenarios. So even when you go seek health services at a dentist, you are allowed to ask the questions that you need to ask, and make sure also you are attended in a place that they're observing strict infection control.
That's very important.
Yes, they have proper infection control procedures. Yes. Because you might have gone there just because of a toothache, but then problems develop. But also I'd say the moment you get complications after, that is the ideal time to go now seek further services. And as we've always said, if you've gone to one dentist or probably one healthcare professional and you're not satisfied with their service, you're allowed to seek a second opinion or even a third opinion until you're satisfied. But do not wait until the problem has advanced so much that now you go to a hospital and then now you're fighting for your life. Yes.
Well, let's not allow it to go up to that far. Another question, someone says, hi, kindly ask for me, daktari, anangoa meno nangapi, root canal na pia filling. There's also something that we have as Kenyans. I already know what I want. So instead of even hearing from you whether it can be a root canal, it can be whatever it is, ngoa. Just ngoa imeno, but anauliza unangoa nangapi and what not, and anauliza also about the root canal na pia filling.
You see, with the advent of technology, patients are informed. Ataenda YouTube one procedure. Hata ataangalia one meno yake. Sasa hii ni ya kungoa. And they've made the verdict.
Of course.
it's okay.
Yeah.
Information is good. Ignorance is no defense. It's okay. Come with information. We'll have a discussion now. Discuss it from a science point of view. Because at the end of the day, patients also have a right to consent to treatment.
Alright.
You'll explain to them they'll need a filling, they'll need a root canal, and then they'll say, I'll need extraction. It's now within your limit as the dentist to say, do you accept to do that treatment per the patient?
Yeah.
If you feel you are not comfortable and you've explained to them all the options that they need and they still need to do another procedure, if you agree to do it, well and good.
Okay.
Because at the end of the day, there has to be informed consent from the patient. Yeah, so for extractions, depends. Can start from 3,000, depending with what sort of extraction needs to be done, up to 15,000 if it's what we call a surgical disimpaction, the removal of the last molar. Okay, then fillings start from 4,000 depending with what needs to be done.
Okay.
A root canal can start from as low as 12,000 to 15,000. So there are various factors that we check. Yes.
All right, there's
Yes.
another call coming in. Dombe, good morning.
Morning to you.
Morning.
Nimucheke tena
Mosheke, you back.
and I'm back. In fact,
Zima radio kwanza.
nimefurahia daktari sana. Swali sasa ile nataka kuuliza, namwambia kuna huyo nini alienda immediately. In fact daktari yule alikuwa amemuua meno. Alienda akaona, sababu ni mtu alikuwa anajulikana, alienda akaona labda nini imefura, sijui hawezi kufanya nini, alafu akamrefer to another nini in Meru to another dentist in Meru town. Huyo Meru dentist after kuchukua kumwambia alipe consultation nini na akaona probably kuko na problem, ndio akamrefer to Sogoria Hospital. Sogoria Hospital alikaa for almost 4 days akiwa sawa, alafu all of a sudden akaaga. So nafikiri there must be some negligence kwa huyo daktari wa kwanza, because aliletewa wakati meno ilikuwa imeanza kutoa pasi na kufura, alafu akamrefer to another daktari rafiki yake. So wamekula. So what I wanted to ask the daktari, is it possible kusuu huyo daktari dentist?
I do not have the details of the case, so I wouldn't really comment, unless now you see you can only comment of the issues that you're familiar with and you know the circumstances around it. You're the one who's familiar.
Can I call it up?
Yes.
Okay.
Yes.
Alafu hii yangu nafikiri umenieleza, nimeshukuru sana. Asante.
Sawa Mosheke. Haya.
Okay.
All right. He seems really concerned.
Yes.
Anataka kufollow up. You can actually as well. I see Brian from Kibra nasema, why do I feel like vomiting when I brush my teeth?
Probably you put your tongue too back. Okay. There are people who have what we call a hyperactive gag reflex. Okay. If ataki, when the dentist is even attending to them, it's a problem. So don't put your when you're brushing your tongue, don't put your toothbrush too back. Okay, so it helps. So maybe they are putting their toothbrush too back, or probably the other issues that are happening. Yes, but the most common thing is unaeka toothbrush huko nyuma inakusumbua. Or there are people who kitu ikifika nyuma huko, they feel like they want to vomit. Yes.
Someone is also saying on WhatsApp, hi, my mama kona shida ya jino, amejaribu dawa za kienyeji na painkillers. What is the best option for her to take? Najua hajakuwa specific on what exactly the mom is going on, but there's also the use of herbal things and whatnot. But so what is the best option for her to take? I don't know how you'd advise on that.
The best option is first to drop kienyeji kwanza, akujie town. Anyway.
Dr. Jonas kumoja.
Anyway, the thing is, the thing with herbal medicine is it's alternative medicine.
Okay.
But the problem is we do not know what extent we are supposed to use.
Okay.
And you see, the thing with science is tests have been done.
Yeah.
And they've known this is the quantity of things that you need to use. So I tell them, the kienyeji might have worked kidogo, like
Yeah.
the way people sometimes put cloves in their teeth to relieve the pain.
Yeah.
It is soothing, but now you have not addressed the core problem.
Yeah.
Okay, which is either a cavity that is there. That thing will give a temporary relief.
Yes.
Then after that you'll get the same pain. Sawa, let them
Yeah.
go see a dentist.
Okay.
Then they'll be advised, because if they take even painkillers, to what extent?
Yeah.
Okay,
Yeah.
because what are they fighting? Okay,
Yeah.
because even if you're putting out a fire, you need to know the source of fire.
Yeah.
Okay, you can't just washa you extinguisher in a,
There's nothing.
there's nothing. Itatoa tu nini, ama umwagilia mchanga, ama unafunika na depending with your method of fighting the fire.
Yeah.
So
At least visit the dentist.
visit the
first.
dentist, see
Yeah.
the cause of whatever is happening,
Yeah.
then proper treatment will be addressed. Yes.
All right.
Yes.
As you come to a close, before you can let us know how we can reach out to you, how do we prevent the gum diseases? Because for someone who's saying, hey, nani kama nimekuwa nikinotice something,
Yes.
know, the early stages of
Yes,
it,
yes,
but
yes.
how can we actually now prevent it so that it doesn't, go up to tartar and all those things?
Fantastic. Actually, the most important thing is prevention. First of all, proper oral hygiene. I'll re-emphasize and emphasize. Try as much as possible, brush your teeth twice. Some instances it might not be possible, but at least brush once. Floss regularly. Okay? If you can, snack on healthy diets, that is fruit and things that are not very cardiogenic. Okay, the other bit is regularly see your dentist, at least every 6 months, so that they can address issues when they come, as early as they come. The other thing is you have other systemic disease like diabetes, which, as I told you, predisposes you to gum disease,
Yeah.
or is a risk factor. See the dentist, they'll be able to assess your teeth and advise as soon as possible. If you're expectant, see the dentist.
Yeah.
As you schedule your ANC visits, hapo ndani
Unaingia tu hapo kwa
unaingia
dentist.
unaingia hapo kwa dentist.
Yeah.
And it's even a call to even the dentist working within the counties. If you can visit our ANC centers,
That would be good.
advise even the nurses
Yeah.
to at least when the patients come, maybe even in the second trimester, let them go see the dentist, then that can be addressed. Okay, if you noticed a problem has started,
Okay.
maybe now you haven't done all those things, you have a bit of bleeding when you brush, or you see some blood when you spit,
Yeah.
okay, or you're feeling a bit of sensitivity, that is your call or cue to go see the dentist.
Yeah.
Then those issues will need to be addressed. If the process has begun and
Yeah.
there's disease, they'll have cleaning done. If there's any procedure that needs to be sorted, then it will be sorted. Yes.
All right.
Yes.
Lastly, a question here. Someone says, I did root canal, but when I take hot tea, it's sensitive. It's been 1 month.
It's been 1 month. So initially, it's not supposed to be sensitive, but you see, healing is also a process.
Okay.
Okay, if there was pain and the pain now has gone, we can't yet say the process has the root canal has failed yet.
Okay.
We give it some time, see if the pain has resolved. Okay, then or probably is it an adjacent tooth that's causing the sensitivity, or is it that particular tooth that had root canal done?
Okay.
Yes.
All right.
Yes.
But maswali ni mingi, we cannot exhaust all of them, but how do we get in touch with you?
As I said again, we are at we are Family Health Dental Clinic. We are located at the Point Mall, Naivas Buruburu, and also at T-Mall 3rd floor. My number is 0726 935 300. Or you can also reach us on 0723 803 883. Yes.
Namba
yes.
yako tena?
Namba yangu ni 0726 935 300.